Hi there, thanks for joining me to learn more about the Young Living Health Plans powered by Clearwater. These are great health plans that can help save you money, help your friends, your family, small businesses, holistic wellness centers, so much more. I'm excited to help you learn more. Let's first start talking about healthcare facts. 30 million people don't have health insurance, so this leaves so many people without any kind of coverage. These plans can help. And then 65 million independent contract workers only have limited expensive options. So again, these plans can help so many people. Two-thirds of respondents of a survey avoided seeking medical help because of financial worries. And a survey from 2021 showed that 50% of Americans have medical debt. More than 65% of bankruptcies involve medical debt, and 90% of those people had insurance. So it really goes to show that just because you have insurance doesn't mean that you have coverage. The health insurance system is truly broken. But thankfully, Young Living has partnered with Clearwater, who is a healthcare vendor. They've been around since 2018 and have tons of experience with traditional healthcare and health sharing plans. So ClearShare is what we've partnered with, what who Young Living has partnered with. It's going to help put healthcare decisions back in your own hands. And Clearwater is what we like to call the Young Living of Healthcare. They want to disrupt the health insurance industry, just like Young Living wants to disrupt the wellness and health industry. So what is a health share? Health shares have been around since the 1970s. They tend to be more religiously focused back in the day, but this health share is not religiously focused. It is a community of people who pool their money together to help each other pay for their medical expenses. Everybody pays a monthly contribution, and that replaces traditional health insurance premiums. These contributions form a shared pool of money that help to pay for medical costs. Everybody has a responsibility amount called an annual max. This is similar to a deductible. Once your annual max is paid, typically 100% of your medical expenses is shareable, meaning covered. This is not health insurance, however. So in these 5 states, California, New Jersey, Rhode Island, Vermont, and Washington, D.C., you will need to pay the tax penalty for not being Affordable Care Act compliant, or you can talk to your tax advisor. Typically, the tax penalty is not hugely significant, especially if you're switching from a traditional health insurance plan. You're still going to be saving so much money from switching to this kind of a plan that paying for the fine will be minimal. So here's the major differences between health sharing and traditional health insurance. Most traditional health insurance plans are for profit. They have a premium that you pay every month, but they have a very limited access to plan providers. You have a network. You pay your deductible. Once your deductible is paid, it's usually a huge amount. Once that's paid, if it's paid, then you still have a co-payment where you are paying for each visit, and even after your deductible is paid, there's usually an 80-20 split where you're still responsible for 20% of all your medical costs. There's a high claims denial rate. This is always shifting, always changing, so you never know if your claim is going to be paid for. Also, traditional health insurance plan companies have huge departments scouring through claims to find that one little thing that will help them deny that claim. As you can see from the stats that we shared earlier, there's a huge claims denial rate, which leads to an increased or hugely, sadly, high number of people with medical debt. Government regulation of health insurances is there, and some people think that makes it all safe. But again, going back to those statistics, just because you have insurance and it's regulated does not mean that your care will be covered. Versus health sharing, which is a nonprofit organization. It's a cooperative arrangement of people sharing their money to pay for everybody's costs. Our ClearShare plan has an open network of providers. There's actually no network. There's an annual max. Once that's paid, then your medical expenses are shared. And if you prefer to see holistic practitioners and goes to holistic services, usually you're paying out of pocket for all of that. So with our holistic plans, you're going to pay a low cost per visit fee. This puts your healthcare decisions back in your hands. You're going to be seeing the people that you want to see without spending a ton of money. So we've got essentially 3 plans. We've got ClearShare, we've got Holistic, and then we've got Holistic plus ClearShare. So ClearShare is the plan for anybody who just wants coverage for medical illnesses and emergency care. We've got 2 holistic plans. These are great for people who prefer holistic services. Maybe your partner or spouse has insurance through their work, or you have insurance through your work. You can enroll the rest of your family on the Holistic plus the ClearShare plan, and then you can get your insurance for free through the employer. But you can add on the holistic plan to any traditional health insurance plan, or this one is also available for people who are over 65 on Medicare. This is the only plan that anyone over 65 can add on. Then we've got the combination plans, the most robust holistic and ClearShare plans for people who want a blend of holistic and medical and emergency care. So this is a great chart. Maybe you might want to screenshot it. It gives you a big kind of overview of what is included in all these plans. So let's start here with ClearShare. This is the medical emergency plan. You're going to get your emergency and urgent care taken care of. You'll have $0 telemedicine, 24/7, 365 days a year. You'll receive an app once you're a member, and you'll have access to telemedicine through your phone or through the website 24/7. You'll also have access to $0 care coordination services, which I'm going to go into in a little bit, which is an amazing perk. $0 virtual mental health services, childbirth delivery services are included. So even birth center and home births are included. $0 generics as well. So with the 2 holistic plans, we've got holistic savings and the holistic plan. You will still have a fee for service, but you will get a huge amount of money back, which I'll go into in just a bit. So for the holistic plans, you're going to have a $50 to $75 Young Living supplement and or oil monthly reimbursement. You'll have functional primary visits that you can use for preventative visits, specialist visits with an MD, a doctor of osteopathy, even a naturopath. You will also have chiropractic and acupuncture benefits, IV drip, and thermography. So the holistic plan is a standalone plan. You can add this to your traditional health insurance if you want. This one includes the Young Living essential oils and supplements, and up to 5 visits per calendar year per person to see a primary care practitioner. So that might be an MD, a DO, or a naturopath. You will end up paying upfront to your practitioner. You'll receive your invoice. You'll submit your invoice to the holistic needs request form, and you'll end up paying $20 for that visit. You'll get up to $150 back straight into your bank account, direct deposit into your bank account. Anything over that, you will not be reimbursed for. So you can get some, really great care with a naturopath up to 5 times and get $150 back. Thermography, mammography is included 1 per year. You'll end up paying $150 first, and then you will have the rest of it paid for through the health share. This holistic plan includes 24 visits with an acupuncturist or chiropractor per person per year. And so you will end up paying your chiropractor or your acupuncturist upfront for your visit. You'll submit your invoice to the holistic needs request form, and then you will end up paying $35 for the visit, and you'll get up to $175 back per visit, per person, per calendar year. So a lot of people ask, is massage covered? Can I get a raindrop? Can I get NAET, all, cold laser, all of those really wonderful holistic modalities. With the holistic plan, technically no, but here's your little loophole that I'm going to teach you. Go and find a chiropractor or an acupuncturist that has those add-on services in their wellness center. Get them on the same day as your chiropractic or acupuncture visit. Get an invoice that's itemized that you will then submit via the holistic needs request form, and you'll end up paying $35, getting $175 back. So we recommend that you add on services so that your visit is as close to $210 as possible, so that you can maximize and get that $175 back, ending up only paying $35 for all that wonderful care. And you'll get one IV drip per month, where you'll end up paying $25 per visit and get up to $100 back per month. So a lot of people ask, like, how is this even beneficial to ClearShare? It's beneficial because they want you to be proactive with your health, and they know that these kinds of holistic services can benefit your health and wellness. The holistic savings plan just gives you some holistic services, but not all of them. So you'll still get your Young Living essential oil and supplement reimbursement. You'll still get primary care visits. You're just going to have 3 per person per calendar year. You're going to have 12 visits with a chiropractor and or acupuncturist. It can be anytime. There's no specific one per month or anything like that. If you needed to get 12 visits all in 1 month, you could do that. You can space it out however you want. You have the freedom to use these 12 visits per year however you want. There's no medical need requirement for these either. The monthly wellness reimbursement with Young Living essential oils and supplements for individuals is $50, and for couples or families, you get $75. You'll order your supplements or oils every single month through your Young Living membership, customer membership, and then you'll download your invoice or screenshot it and then submit it through via the holistic needs request form, and then you're going to get that money reimbursed to you, direct deposited into your bank account each month. So you can get up to $900 worth of product for free by being on this plan. And then if you put your products on loyalty rewards, which is our monthly customizable subscription box, then you can earn points, loyalty reward points, that you can also redeem for free products. So if you're brand new to Young Living and you don't have a Young Living customer account, you will need to get one to get on these plans because they are exclusive to Young Living members. There's no requirement to order products, but if you're on the holistic plan or the holistic savings plan, you might as well order products since you're basically getting them for free. You're going to pay up front, but you'll be reimbursed within 30 days for your products. So any of the supplements, any of our essential oils, Ninja Red, which is our superfood antioxidant drink, is also included. So definitely talk to the person who sent you this video so that you can learn more about loyalty rewards. Let's talk now about all the benefits that you will have through ClearShare, which is the medical and emergency plan. So you're going to get all of these things, no network. You have hospital birth, birth center, home birth. You have all of these things, even including massage therapy. So if you have a medical need and you are prescribed massage therapy or even hyperbaric chamber therapy, these things are included, even hospice care and weight reduction. So most of these things need to be pre-approved and need to be related to a new medical need, not a pre-existing medical need. So care coordination is a really amazing perk. You're going to use this for planned procedures, nothing emergent, nothing medically important. You can use these for labs, x-rays, MRIs, biopsies, and surgeries. For these specific health issues, you will use care coordination first. You will contact the care coordinator team ideally 21 days before you'd like to get the service done, whether these are the labs, x-rays, MRIs, biopsies, surgeries, or any of these issues. And then they're going to do their research and find preferred providers that they know provide excellent care, have excellent outcomes, and cost way less. So they'll get back to you in a few weeks once they do their research. And if you use their recommended provider, the care will be absolutely free. You won't even need to pay for your annual max. You can also use care coordination to request a second opinion. And if you choose not to use their preferred provider, that's fine. You can see any provider you want. You'll end up paying your annual max first. So why do they require care coordination for these specific services? They just want to make sure that you're getting the best care with the best services and the best outcomes. So they like to find the practitioners that they recommend for these kinds of procedures. But again, like I said, it's not required that you use them, but if you do use the recommended provider, you won't even have to pay your annual max. So let's take an example like a knee surgery. It's not an emergency situation. Your knee has been bothering you and you have this health plan, and then your doctor wrote a prescription for surgery. You're going to submit that to care coordination. You're going to wait the 21 days, and then they're going to come back with a provider that they recommend. Typically, it's going to be a medical surgery center, which is a smaller surgery center not associated with the hospital. Hospitals cost a lot more. The care can be iffy. In a medical surgery center, the care is excellent because they have a smaller patient to staff ratio. Therefore, the outcomes are way better and there's usually less need for follow-up. And it costs way less. So a surgery in a surgery center might cost, let's say, 40,000, whereas a surgery in a hospital might cost 80,000. So ClearShare would prefer you getting better care, better outcomes, having it cost less, and to reward you, they're going to pay for the whole thing and waive your annual max. It's pretty amazing. And here are some extra perks of ClearShare: end-of-life assistance. If anybody in your family dies, you will get financial assistance. And if any of your family members of children up to the age of 18 attempt suicide or have a suicide, they will give you money for that because they know that it's very much needed and it would very much help the family. So here's what it costs for Holistic plus ClearShare. So this is a most robust plan. This is all of those holistic services: 24 acupuncture, chiropractic visits, IV drip, thermography, plus the medical and emergency care. So there's $1,000 annual max, a $2,500 annual max, and a $5,000 annual max. And then it goes by single, married, or cohabitating adults, single with kids, family with kids. And there's no limit on how many children you have. So you could have 10 children and it's still the same price. It also covers your unmarried children up to the age of 26, even if they're not living in your household. Here's the Holistic Savings Plan. This is the one that includes 12 acupuncture and chiropractic visits and the medical and emergency care. Next up, this is the pricing plan for either the Holistic Savings or the Holistic Plan by itself. So these are the add-on plans. If you have traditional health insurance, you can add these on. But like I said before, I would recommend just keeping your traditional health insurance for the person who gets it for free through their work, and then signing up the rest of the family or you for the Holistic Plan or ClearShare and the Holistic Plan, so that you could get all these great services. And so remember, with these plans, you're also going to get the $50 to $75 Young Living supplement or oils reimbursement each month, and all of those other benefits. You're still going to have $0 telemedicine available to you and virtual mental health services as well. With the holistic plan, if you're just getting the holistic plan, there's no annual max. You can immediately start using the plan and getting your reimbursements right away. You're going to have your reimbursements showing up in your bank account within 30 days. And there's no pre-existing condition exclusions. So for anyone dealing with an autoimmune disease or chronic disease or cancer who loves seeing holistic practitioners and getting holistic services, these plans are amazing because it's really going to help them save their out-of-pocket costs. Individuals over 65 are also eligible for the holistic plan to add on to Medicare. So Clearwater really is investing in our long-term health now, reimbursing us for being proactive now, because they know that investing in our health now helps prevent long-term issues later. And here's the pricing plan for just the ClearShare. So this is coverage for accidents, emergencies, major illnesses. It's a great plan for people who are generally healthy, and a lot of people are on government assisted healthcare, but those plans have awful benefits. The network's really limited and the services are extremely limited. So even though paying for ClearShare might be a little bit more out of pocket, you're going to have way better services, benefits, and coverage available to you. So it's definitely worth looking into. And these are also great to offer to, if you have a small business or a wellness practice, to offer to your employees. I'll talk more about that in a bit. So who's eligible for these plans? Any Young Living brand partner or customer. These are United States plans exclusively only for now. We're working on that. But you can become a Young Living member for free. There's no requirement to purchase anything ever, no requirement to do the business ever, but you just need to create a free Young Living member account. So definitely talk to the person who sent you this video so that you can use their referral number. Anyone over the age of 65 is eligible only for the holistic plan, and unmarried children up to the age of 26 living outside of your household can also qualify for your family plan. Anyone with an ITIN is also, they have access to these plans as well. There's a year-round monthly enrollment, so there's no limited, only able to have your enrollment happen during open enrollment time. Every month you can enroll in these plans. So the way it works is you'll enroll this month and you won't end up paying a dime. You also won't have access to services. But then starting the 1st of next month, you'll start having services, and then you'll be billed next month in between the 6th and the 10th of the month, and then in between the 6th and the 10th of the month from that point on. So any month that you want to sign up, you can sign up knowing that next month, starting on the 1st of the month, you'll have access to services. And then another pro tip, if you have a spouse or a partner that lives in your home, you definitely want to sign up as a Young Living member, become a brand partner, which is a business person, and then sign your spouse or partner up. So then they can sign up on the health plan that you desire, and then you have the ability to earn commission on your family's health coverage. If you'd like to watch a pre-recorded webinar or schedule a one-on-one consultation with one of the ClearShare benefits consultants, you can scan this QR code here. Make sure that you're letting them know that you're interested in the Young Living health plans. So when you're ready to sign up for the Young Living health plan, you're going to log into your account if you already have one, or use the referral link from the friend that sent you this video. Then you'll go to the Young Living health plan landing page on the Young Living website. So when you go to the Young Living website, at this point, just scroll down and you'll find a little banner that says Young Living health plans, explore plans. You'll go there and click explore plans again, and that'll take you to the Young Living health plan enrollment website. You'll want to make sure you enroll the month before you want coverage to start, and then you'll be billed the following month. So if you're interested in earning some extra income of reliable recurring income stay tuned because this is great for individuals to share. It's great for small businesses and even holistic practitioners that have wellness centers. So how does it help a holistic practitioner? You can offer healthcare savings to your patients, a health plan that aligns with holistic services and holistic beliefs. There's no network. Patients can use their own provider or any provider. There's no medical need. If they're signed up for the holistic savings or holistic plan, you don't have a limited number of services available per medical need. It's also going to help you increase your revenue because, like we talked about, encourage your clients or patients to get services close to 210 each time. For each visit, you'll provide that itemized invoice of the visit plus the add-on services, and then they'll end up paying $35 and get up to $175 reimbursed. You'll still get all your money up front, so there's no risk to you. You'll also add a recurring stream of income because every person that signs up for a health plan, every month that they pay for their health plan, you'll earn some money. So patients will save money, which leads to hopefully them seeing you more often. And how does it benefit a small business owner? Businesses less than 49 employees are not required to provide health care coverage, but most of the time, those employees are on government assisted or really low cost, low services, low benefits kinds of plans. So you can offer healthcare savings to your employees at no additional cost. It can be a perk of being your employee. They'll sign up for their own plan using their own money. You'll become a Young Living brand partner and you'll be able to earn recurring income from each of the employees that enrolls. And even when they quit, if they quit, as long as they're paying for their health plan, you will still earn commission. So you can use these health plans as an employee retention tool because you can reimburse your employees a small percentage of their health plan for each year that they remain an employee. So you'll be earning commission from each person that is enrolled. And as you saw, the pricing of these health plans is not crazy expensive. So the longer that they stay, maybe you're reimbursing them 10% or 20% or even 50% of their health plan. We all know it's really hard to keep good employees, so you might as well find little ways to help ensure that your employees are happy where they are. So here's a chart that's going to explain how you can earn money with these health plans. We're going to take this little scenario here. 40 to 49-year-old with a family that's enrolled on the Holistic plus the Clear Share plan. This is the one that has 24 acupuncture chiropractic visits. Each product in Young Living has a point value, and this Holistic plus Clear Share plan for a 40 to 49-year-old person has a 101 point value. Then, because they're on the holistic plan, you're going to encourage them to sign up for loyalty rewards or at least purchase their $75 worth of product of supplements or oils on their Young Living account, which will have 75 point value. So total per month for this one person, you will have 175 point value every single month. And if you took that and you signed up 57 people with that scenario, you would have this much point value total each month. Now, if you go over here to the 2024 income disclosure statement, you'll see that silver is the rank that you have when you hit 10,000 point value. And the average income for a silver annually is $18,000. So I don't know anyone who wouldn't benefit from having an extra 18,000 per year. And then you go up and up and up, and you could earn anything from here, $31 to potentially over $1 million by enrolling people on these health plans. So you'll earn commission from each person on a health plan. And you will also earn commission when they're on a holistic health plan and they purchase that $50 to $75 worth of product, supplements or oils each month. So that point value is going to show up every single month. You will have consistent business volume every single month. Now, how it works is people will sign up for their plan. They'll sign up the month before they want the coverage to start. Then they'll be billed by ClearShare the following month between the 6th and the 10th. That point value then is added by Young Living around the 25th of that following month. And then we get paid the month after, just like we typically get paid in Young Living. We get paid the month after for the point value for everybody in our downline. So with Young Living's Fast Start bonus, typically you're going to have 50% commission of the point value or PV of month 1 and 25% commission on months 2 and 3 of the PV. But with this health plan, because people are signing up in month 1 and there's no PV, you'll earn 25% of the PV for month 2 and 3, and then you'll have the unilevel 8% down to 4%, depending on what level they are under you, showing up every single month after that. So here are some testimonials from some people that are loving this health plan, that there's so many benefits to having this: peace of mind, knowing that anything catastrophic will be taken care of, but also all of those wonderful holistic services. This person was with a different health share for years. They never really used it, but it didn't cover holistic services, and now they love this plan. This person had been paying $800 a month for a health plan with a $10,000 deductible and is going to be saving so much money with the holistic and ClearShare plan. This person saving $20,000 a year. They switched from their PPO to this plan and now love having all of these holistic features and benefits. So this person was able to use the $0 telemedicine for a bee sting that she wasn't quite sure what was happening and wanted to get coverage and care taken care of. It was the weekend. She was out in the middle of nowhere in Texas and was able to get confirmation that she was okay and even had a prescription filled. Here are people saving massive amounts of money: $700, $780 a month, not including chiropractic and acupuncture visits or monthly Young Living orders, saving $170 a month, saving $450 a month. This person submitted a claim for x-rays and chiropractic visit, and then even got a little bit more because they didn't include the x-rays. The customer service is really, really excellent and very available for support and help. This person belongs to a place called Restore Wellness. They pay a monthly fee for cryotherapy, red light, sauna, lymph drainage, and 1 IV a month. So once they get their IV drips reimbursement from ClearShare from the holistic plan, they end up paying $49 a month for all of those services, which is really, really nice. And this person's super excited about having $900 a year reimbursed for their Young Living products that they were already buying. This person had no insurance, couldn't afford it, had been going through a costly divorce and lack of finances, but being able to be on a plan and share with other people is, she says, an answer to a prayer. This person has been sharing with chiropractors, acupuncturists, naturopaths, and they're very excited about offering the health plans to their clients. And this person's used the Amaze Telemed app and care coordination and has been loving it. So thank you so much for watching this webinar. If you're new to Young Living and haven't purchased in the past 13 months, please get the referral link from the friend who shared this webinar with you. If you are an existing member, you can visit the Young Living Health Plan website for a complimentary quote, a one-on-one consultation, or to enroll in the health plan. So this is the website. that you'll go to after you create your Young Living account. Once you have your Young Living member number, this is where you can go to sign up for a health plan. We also have a Facebook group. If you're on Facebook, you'd love to learn more about the health plan, or you're a Young Living brand partner and you'd love resources to share with your friends, family, practitioners that you know, scan this QR code and that'll help get you into our Facebook group.